And it is a Friday, so of course we do have a special guest in the studio here, Dr. Valerie Tey dental specialist in prosthodontics, international certificate of the American Board of Dental Sleep Medicine, and she's with the T32 Dental Group. Hello, Dr. Valerie, how are you?
Hi, Mike. Hi. Thanks for having me on the show.
No, thanks for coming on the show and gracing us with your knowledge. It's great to have, doctors and dentists and prosthodontics. That sounds like something
prosthodontics, yeah.
It sounds, I don't know why. Maybe it's because I just saw one of the dinosaur movies. It sounds like something in that world. So tell me, what is prosthodontics?
So as a prosthodontist, we look at restoring and maintaining oral function, comfort, and appearance for patients who have missing or damaged teeth, in particular. Okay. Yeah. So missing teeth can be missing or damaged for many reasons, as we know. So...
bar fights and stuff like that. Anything.
For sure. That's high on the list.
You know what?
Depending on where you come from.
I know, right? I am so upset that I didn't come to see you to get my teeth fixed because I have, what do you call them? Teeth.
Dental.
I don't know what I'm trying to say. I have fake teeth.
Replacements.
Yeah. They made the teeth and then put it in.
I see.
Yeah.
Did you have any surgery done or it was just fixed on the teeth?
I don't know, man, but whatever he gave me, it was awesome.
Yeah. Oh, great.
Like I was out.
Good. As long as it feels like what you should be having.
I was awake, but I wasn't. But I was a little bit out of it, whatever that is. I don't know what that is, but it was So I guess it was surgery, right? I mean, he had to attach it to something way deep inside, right? Like he shaves the teeth down, then attached it to that. Yeah. Yeah. Okay.
That sounds a bit like a bridge. Yeah.
A bridge. Okay.
Yeah,
so
something like that.
So you're on to talk about
dental implants.
Dental implants. Yeah.
Yeah. Dental implants. Usually, you go through a very very tiny minor procedure whereby, if you're missing a tooth, usually we use it when there is a gap or a missing tooth or more than one missing teeth, we use it to substitute the roots of the teeth. Okay. And so they kind of anchor in the dental alveolar part of the jawbone, and we use that as a support.
I understand.
To hold the teeth there, yeah.
So if there's nothing in there, like the tooth has gone so bad that you had to pull the whole thing out, there's no root.
Yes.
Then you can put the implant in there. Then you put a tooth on it.
That is right. Exactly. But if your teeth are still
usable,
healthy enough, usable, then we can also restore those teeth with things like crowns, bridges, and that's basically what a lot of the work in prosthodontics actually is. It's
that one, not so much the implants.
Yeah, in terms of reconstruction for implants versus teeth, because you have to rebuild the root.
Yeah.
So in terms of the process, it's a little bit more... we have to reconstruct from a deeper level. Yeah.
Is that good to go for pretty much the rest of your life if you get one of those? Or do you have to take it out at some point?
So they have pretty good longevity. So I always tell my patients the nice thing about implants is that they don't decay. Because they're not your teeth, not actual tooth, but they are still susceptible to things like infections, like gum infections, just like how we can get gum infections around our own teeth as well.
Right.
So typically it's important to have good maintenance for the implants after they have been completed, just like how we want to maintain our own teeth, just to keep everything at bay. And of course, having good overall health is very beneficial in all of this.
Okay.
Keeping infections at bay, inflammation on a lower level, things like that.
Yeah, I mean, I did experience that because after I got mine done, when I went back just for a regular teeth cleaning, like maybe a year later or something, or whenever it was, the dentist at that point said, your gums are not doing so great around the new teeth.
Okay.
And so he said, look, just, it might be that they're just not reacting well to whatever he put in, or because you're not doing enough maintenance. And so then I really for me now, I have to go extra on the maintenance. so extra. Like I have to do like, I brush more, I floss more, maybe a couple times a day floss, and then I found that where I don't usually like to use mouthwash, now I have to use mouthwash. It really does work for me.
Okay.
Yeah.
Okay.
So anybody.
Yeah. So very often, yeah.
I'm sorry.
Very often there may be different ways to maintain it, like what you mentioned, flosses, brushing, and sometimes special brushes. Yeah, water flosses are also a good adjunct.
Yeah.
And usually more than one tool is required, as you have very well highlighted.
Yeah.
So yeah.
Is there anything else?
A little maintenance.
Yeah, just you around. I would say you also need to visit your dentist every 4 to 6 months or something. Yes.
Yeah, so that again is part of the maintenance regime. We, despite our best efforts, we might miss a corner or two, or some things need to be done professionally. So the regular visits are important. As to the interval, that is really, the average is about 6 months, but it could vary from, 4 to 9 months, depending on individuals' level of hygiene, how well they maintain it, their oral condition, general health, dexterity, so many things.
That's great. Okay, fantastic. Well, Dr. Valerie, I don't want to let you go. You are awesome. I'm really enjoying talking to you. But this is Dr. Valerie Tey Hui Shin. She's with T32 Dental Group. So if you're missing a tooth right now, just drive over to T32 Dental Group right now and go see Dr. Valerie Tey. Thanks for coming on.
Thank you. Thank you.